Hello everyone, let's have a quick mind map scenario for Vertigo station. You can use the same structure for almost every Vertigo station here, and this one will be the benign Vertigo. So let's start. The patient will come with a presenting complaint. We'll cover here all data gathering, all management domain, and your interpersonal skills as well will be covered in somehow. So data gathering, yeah. The patient is coming with dizzy spells or feeling dizzy or the room is spinning. So this is the presenting complaint, and the first step in our structure is exploring the presenting complaint. So Mr. Jack, tell me more about that. So you start with an open question to listen to the golden minute. Give the patient some time to help you. Mr. Jack, tell me more about these dizzy spells. He will talk and talk and talk and listen carefully because this is the golden minute. After the patient does finish his golden minute, you can explore the presenting complaint with other questions if he forgot to mention something important for you to know from Udibara, okay? Or another style you can use for dizziness. Consider dizziness as an event, so you can ask before, during, and after. So before you felt dizzy, did you have any symptoms at all? Any blurry vision? Any noise in your ear? Any heart racing at all? And during, how long did it last? How long did you feel dizzy for? Okay, did you lose consciousness at all? After, did you have any headache or confusion? So you can explore dizziness with that manner or with Udibara, it's fine. But the most important step is actually listening to the patient, because he will give you the diagnosis. He will mention, doctor, I have dizzy spells, they started few days ago, it does only last for seconds, and they do happen with changing my neck position. So he is helping you. Okay, second step in presenting complaint, as we always do in every single mind map, is asking about trigger, because trigger is a healthy question. Mr. Jack, was there anything triggering these spells at all? Yes, doctor, yes, they do get worse when I move my neck. So he's helping you to get to the diagnosis. Or maybe, yes, doctor, I had a viral infection last week. So he's guiding you to vestibular neuronitis then. So trigger is a healthy question, just one question. Was there anything triggering that for you, Mr. Jack? And then any associated symptom. So we finish presenting complaint by any associated symptoms with that, especially feeling sick or vomiting is common to happen with dizzy spells. Then my second step in every single mind map is close the specific questions to rule out red flags or differential. What will be my red flag here? Central causes of vertigo. So one or two quick questions about that. Mr. Jack, do you have or did you have any weakness or numbness in your face or in your limbs? No, doctor. And then my second close the question would be about ear symptoms for peripheral causes. So did you have any symptoms in your ear at all? No, doctor. Yeah. So did you have any noise in your ear, any bleeding from your ear, any hearing problem at all? No, doctor. Or yes, doctor. Yeah. Okay. And then third step, general well-being of the patient, or what you like to call maftosa. I don't mind, but make it relevant maftosa. So past medical history of ear problems at all, or dizzy spells like that before. Are you using any medication, Mr. Jack, on regular basis? And I'm caring to know about the ototoxic medication, for example, aspirin or certain antibiotics, yeah, if he's mentioning them. So do you use any medication on regular basis at all? No, doctor, yeah. Any family history of similar problem or ear problems? Always be relevant. Don't ask general questions, yeah. Lifestyle questions, smoking, alcohol. Alcohol is important, and coffee intake and water intake is important. And you will know that in the management. And then I will finish my data gathering as usually and as always by psychosocial and ICE. Mr. Jack, you told me this has been going on for the last 1 or 2 weeks. How that has been affecting you? Has it been stopping you from doing anything you used to do? So psychosocial is important. Or what do you do for a living? Doctor, I'm a taxi driver. Is that relevant information? It is very relevant information, because you need to advise about driving later. Or maybe, what do you do for a living? Doctor, I work in a factory. So you might work with machines. Then I'll finish my data gathering with ICE. What do you think, Mr. Jack, can be causing that for you? Anything in particular worrying you the most? And then, were you hoping for anything specific I can offer you today? Yes, doctor, I would like to have a scan, for example. Okay, so listen to your patient here. That will be your data gathering. You will finish by minute 4 or 5 maximum if you are specific. And then offer examination. Mr. Jack, I would like to examine you. That will include me measuring your blood pressure while sitting and standing. It's very important. Vitals, and especially blood pressure sitting and standing, because he's coming with dizzy spells. I would like to examine your ears as well, and if you don't mind, I'll need to do a maneuver with your neck and head movement to see what kind or what causes these symptoms for you. Will that be okay for you? Yes, doctor. Yeah, which is a Dix-Hallpike test. You can offer examining hearing and doing neuro examination. Okay, it's not an examination station, so you will offer and the examiner will give you the finding that Dix-Hallpike test is positive. So now go to your management. Mr. Jack, having listened to you, having examined you, I think what you got is vertigo. It's a type of vertigo. We call it benign paroxysmal positional vertigo. It's a mouthful term. Have you heard of this term before? So when you start management, you should do two things. The first one, make it simple for the patient. Second one, engaging him with you, and you need to complete that by sharing options. Let's do that. So Mr. Jack, having listened to you, having examined you, it does sound that you got vertigo, what we call benign positional paroxysmal vertigo. Have you heard this term before, or this fancy or this mouthful term before? No, doctor. Yeah. So let me share it with you, Mr. Jack, in a simple way. So benign means it's not serious and it usually self-resolve. And paroxysmal means, Mr. Jack, that it does happen on and off, as you told me. And positional means it does get worse or it does get triggered by changing your position, as you mentioned to me as well. And vertigo simply means the room is spinning or feeling dizzy spells, as you described. Okay, Mr. Jack, so how we can take things further for you, Mr. Jack? There are a few things you can do yourself at home to help with these symptoms, and a few things we can offer you as well. So make it a shared management plan. Things that you can do yourself at home is avoiding a trigger. As you mentioned, Mr. Jack, it can worse with the changing position, so we would advise you to take your position very gradually when you change your position. For example, when you lie down on bed, okay, try to sit down first for a few seconds, move your arms, cross your legs, and then stand up slowly, so we avoid triggering these spells. As well, Mr. Jack, drinking enough water every day will make your symptoms less often to happen, so we usually advise people to drink 2 to 3 liters of water every day. And if you can make a diary for your symptoms, Mr. Jack, that will help me and you reviewing that in the follow-up to try to find any other triggers to work on. Am I making sense? Yes, doctor. Yeah. Mr. Jack, I would like to reassure you that it is a self-limiting problem, so even if we don't do anything, we are expecting it to get better in the coming few weeks. Okay, doctor. Yeah. Things that we can offer you, Mr. Jack, there is a maneuver or exercise that you can do yourself at home that can help you to balance your inner ear, because this problem mainly happens because of dislodged crystals in your inner ear. Will you be happy to try that at home? Yes, doctor. Yeah. It is called the Brandt the Roof exercise, Mr. Jack. I'll print a leaflet for you and you can do it yourself at home. So the other option is doing the maneuver at home, or you can refer him for Ebley maneuver. But this one is more convenient because it doesn't need referral. Yeah. And then you finish every management as we do in every single mind map by safety netting, follow-up, and the leaflet, because you need to be a safe doctor. What do I do in safety netting? I will safety net my patient to please avoid driving until you feel better, or if it does happen while you are driving, or if it does happen without a trigger, you should avoid driving and you should inform DVLA if it's not provoked. Yeah, just avoid driving until you feel better and avoid working with machines until you feel better. Yeah, just a quick safety netting that will do the job. Follow up, I'll be happy to follow you up, Mr. Jack, next week. Let's have another talk and make sure you are getting better. If it doesn't, or if you still have symptoms after a few weeks, we will need to consider referring you to the specialist. Will that be okay for you? Yes, doctor. I'll print a leaflet for you, Mr. Jack, so you can have a read about the exercise and you can have a read about the condition. And if you got any questions, feel free to call me back for a discussion. Thank you. Thank you. This is Vertigo. This is how you can do it in 6-8 minutes with being relevant, following nice guidelines and what we do in UK. Before I finish, just a quick announcement. We have a mind map package which does include more than 300 mind maps similar to the previous one. Every one of them is covered in 5-10 minutes maximum, and it's covering the whole station in relation to data gathering and management and how to do the shared management option. It does cover all BLAP 2 cases that came in the last few years, so you should be covered. And this package as well, it does include access to IBS mechanics course. It's a 1-day course which gives you how to improve your IBS skills lots of phrases to use to improve your style, and you can get access until you pass. And as well, it does give you access to one-day course for all structures you need for BLAP 2, the structure for breaking bad news, for dealing with angry patient, with medical errors, with counseling, with talking to colleagues, with dealing with unreasonable requests, all structures you need step by step, with mind maps covering them. Okay, as well, there is an access for prescription tasks, all prescriptions in UK, anticoagulation, drug charts, end-of-life medication, sick notes, and as well to one day or a small management tutorial to teach you how to share management with the patient and how to score 4 out of 4. All of that in one package, in one capsule, to make you ready for BLAP 2. If you'd like to join, just text me on WhatsApp on that number and you will be very welcome to join. I hope you found the mind map useful and get 12 out of 12. Thank you. You can join our groups as well to find more free maps. The group links will be in the description below. Thank you.